Welcome to Monday's edition of COVID-19. The World Health Organization claims hard-won gains against the pandemic are being threatened by the Delta variant here in this part of the world. Now, we have details later on the program as we connect to Japan and Vietnam. Here first is the broader pandemic coverage with our Kwon So-ah. Now, So-ah, Korea is starting yet another week with over 1,000 new infections.
Yes, Sunny, and it marks the 27th straight day that Korea is posting over 1,000 cases. Now, we're starting off this first Monday of the month with 1,219 infections, with most of these cases being domestic transmissions, but also almost 70 imported cases. And over 300 infections were reported in both the capital, Seoul and Gyeonggi-do province, and also more than 80 cases in Gyeongsangnam-do province, as well as over 70 in the southeastern city of Busan. Now, as of this August 2nd, Korea has surpassed 200,000 infections in total, so it took a little over 4 months to get from 100,000 to 200,000. We do, however, have a drop by more than 200 cases compared to the day before. And also, if we take a look at our Monday figures, we are seeing an on-week drop by almost 100 infections, and that did not happen for the past weeks, as we have been straightly going up on the graph. And also, we are seeing this drop, but officials are warning that it's no time for a sigh of relief. Let's take a listen.
The Liberation Day long weekend is coming up in 2 weeks. We will face an even bigger crisis if we fail to stop the current outbreak, which could also hinder our vaccination process. While containing the virus is difficult amid the summer vacation season, we will have to find a breakthrough solution through cooperation between the government and citizens this week.
Right, well, let's keep our fingers crossed for infections to slow down and inoculations to speed up. Speaking of which, So what is the latest on the vaccination front?
Well, Sunny, beginning this Monday, people aged 60 to 74 can make reservations who are not able to get vaccinated in the first half of the year. And also, people aged 75 and above can book them anytime. Now, meanwhile, the younger population will soon be subject to inoculations, with reservations to start with a prioritized group between August 3rd and August 6th. And that includes essential workers such as delivery workers, as well as public transportation drivers. And regular citizens will make their reservations starting on August 9th, and that will be based on designated days based on the last digit of birth dates. Now, so far, almost 38% of the nation's population has received at least one dose of vaccines. Now, meanwhile, over in other countries around the world, the Delta variant is causing fresh concerns in places like the U.S., Europe, but also China due to a cluster infection linked to Nanjing Airport, and also Vietnam is seeing resurgences. We will later connect to Vietnam, and also a place we will connect to is Japan, which has been seeing over 10,000 cases for 3 straight days since Friday, and because of that, we are seeing state of emergencies places entering state of emergencies, that is 3 prefectures near Tokyo as well as Osaka. Let's also take a quick look at some figures abroad. We are seeing around 20,000 new infections in the US and Brazil, and resurgences in India with over 40,000 new cases reported in the past 24 hours as of noon Korea time. And the total number of cases around the world stands now at 199 million. And those are the updates I have for now. I'll see you back after the government briefing. Back to you, Sunny.
All right, so thank you for now. Right, up next, we shed light on the severe symptoms of COVID-19 and on who is at risk of facing such conditions. Do take a look.
The 4th wave of the outbreak here in Korea has brought with it a surge in the number of daily cases, and also thereby the number of seriously ill patients. Critically ill patients are defined by those requiring intensive respiratory care, such as the use of high-flow oxygen therapy or intubation.
100명이 걸리면 2명에서 4명이 위중증으로 가고, 그 중에서 1명 정도는 사망을 합니다. 폐렴이 전폐, 양측폐를 다 침범을 하기 때문에 산소 교환이 안 되고, 그것 때문에 우리는 강제로 산소를 밀어넣고, 그래도 안 되면 체순환을 시키고, 이런 식으로 해서 치료를 하는데, 결정적인 치료제가 없기 때문에 결국은 환자의 상태에 따라서 사망을 하느냐 살아나느냐에 달려 있는 것이죠.
A great deal of research has been carried out across the globe on who is most susceptible to serious illness from COVID-19. According to a number of recent studies, certain individuals may be genetically predisposed to suffer more severe symptoms after contracting COVID-19. These hereditary risk factors may stem from different genetic variations, including ones that determine one's hair or skin color, for example.
이러한 유전학적 연구는 질병의 발병 기전에 대한 새로운 생물학적 통찰력을 가질 수 있게 하고 치료제 개발을 하는 데 있어서 다양한 기전이나 정말 수많은 후보 약물이 있을 텐데 그중에서 타겟을 찾는 데 있어서 그 타겟을 좁히거나 그 타겟을 찾는 데 드는 시간과 비용을 훨씬 줄여줄 수 있는 역할을 할 것이라고 생각을 합니다.
There have also been many reported cases of patients being reinfected with the coronavirus, especially as new variants continue to emerge. So what are the odds of experiencing a severe illness in cases like these? A group of Korean researchers say the answer may lie in the memory T cells that are present in COVID-19 survivors, created during their first bout with COVID-19, which prevents serious illnesses from occurring in the case of reinfection.
T세포라는 거는 감염을 원천적으로 차단하는 기능이 있는 건 아니지만 일단 감염이 됐을 때 감염된 세포를 빨리빨리 찾아서 제거해 주기 때문에 이 질환이 중증으로 안 가고 빨리 회복되게 해주는 데 굉장히 중요한 역할을 하는 것이죠. 감염이 됐다 하더라도 빨리빨리 감염된 세포를 없애주면서 제가 경증으로 그냥 회복이 되게 만들어준다면 이 바이러스가 우리 사회에 설사 좀 돌아다닌다 하더라도 이제 점점 코로나19라는 이 질환이 점점 뭐 독감이나 감기처럼 좀 약화되는 질환으로 될 수가 있다는 거죠.
However, Korea has also seen a growing number of seriously ill patients that appear to coincide with the spread of the Delta variant as part of the fourth wave. To get their take on this phenomenon, we spoke to a pair of experts from India and the US, countries where the Delta variant has become the most dominant strain.
Whether the Delta variant produces more severe disease, it's still controversial. The Lancet paper from Scotland claims that Delta variant infection is more severe, but other scientists have questioned the more severe nature of the Delta variant. So we are sure that Delta variant is more transmissible. We are not yet sure whether Delta variant produces more severe infection or not.
It's really important that people get vaccinated as soon as they possibly can. We are very lucky to have highly effective vaccines, and that's the only way that's really proven the least expensive and most natural way actually to protect ourselves from the pandemic is to take advantage of our immune systems. And the way that we can train our immune system to fight the virus is the vaccine.
Researchers across the world are continuing to work around the clock, unraveling the mysteries of COVID-19 and finding better ways to manage and contain the coronavirus.
It's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Monday. A vast majority of the nation is under level 3 restrictions until the 8th of August, in line with efforts to better contain the fourth wave, which appears to have expanded its borders to beyond the capital region. Under level 3, a maximum of 4 people can meet for social purposes, with an exception for family members who reside together. Events including weddings and funerals, as well as rallies, can have up to 49 people in attendance. Also, concerts will be allowed only at certified venues. Indoor stadiums can host 20% of their capacity, while their outdoor counterparts face a 30% limit. Places of worship can host 20% of their capacity, and outdoor congregations can have up to 49 people. Businesses including dining and drinking establishments, as well as gyms and cram schools, need to close doors to patrons at 10 p.m. Meanwhile, here's a look at the level 4 social restrictions in place here in the Greater Seoul area, as well as a few other regions, also until the 8th of August. Up to 4 people are allowed to meet for social purposes until 6 in the evening, and after 6, only 2 people can do so. To a large extent, this cap on gatherings also extends to family members who reside together. Weddings and funerals face a ceiling of 49 people. Also, only one-person rallies are permitted. Nightlife entertainment businesses, including bars and clubs, remain shut, while restaurants, cafes, gyms and concert halls are required to close doors at 10 in the evening with strict protocols in place with regard to seating arrangements, ventilation, face masks and visitor logs. The briefing's about to start. We'll come back to you afterwards.
Let us now begin our regular briefing for August 2nd, Monday. First of all, on the vaccination front, here are some updates. As of today at midnight, we have the number of those who have received at least one dose standing at 19.47 million, which means that about 37.9% of the country's total population have received their first dose, and among them 7,146,409 have been fully vaccinated. And the vaccination rate stands as for 80% for those in the age group of 60 and 80s, about 35% who have completed the first dose, and about 77% in the those in the 80s have completed the vaccination process. And also, as for their 50s, they have completed the vaccination process with the first dose by about 83%. And also starting from the 9th of August, we will be rolling out the vaccines and also to those in their 50s, and we will be giving out the Pfizer vaccines regardless of regions. However, at designated hospitals that only have the Moderna rollout, we will be providing them with Moderna shots so that they can roll out these doses. And as for those who are in schedule to have their dose on the second week of August, we will be sending out individual text messages. And as for the senior citizens who have not been inoculated earlier this year, we will also provide some details. And as of the 30th, we have been providing the details, and we have said that at those facilities like nursing facilities and also long-term care centers, we are looking at the newly admitted patients, residents, as well as new workers who have not yet been inoculated. So we are looking at these people who are seniors, and we are also looking at those who have not received the vaccines in the first half of this year, and we will be giving out the AstraZeneca vaccines. And we have been rolling out the vaccines from the 27th of July, and it will continue until the end of August. And also for those over the age of those between 60 and 74 who have not been inoculated earlier this year, we will also provide AstraZeneca vaccines. And you could also book your reservation starting from August 5th at public health community centers and our website going forward. And also, as for those over the age of 70, we are also opening the reservation for the vaccination, that is for these group of people without the need for prior booking, and they will be given the Pfizer shot. And we will also provide these COVID-19 vaccines going forward as well, accordance to our schedule. And as for the vaccine supply, on the 3rd of August, the AstraZeneca vaccines, about 1.18 million doses will arrive, and a total of 28 million doses of vaccines will set to arrive in the month of August. And we also have about 835,000 AstraZeneca vaccines to arrive through the COVAX. And also we have in schedule about 14 million doses of the Moderna vaccines to arrive as well. And as for the detailed, we will be disclosing those detailed numbers depending on our negotiations with the vaccine makers. And here are also updates on our adverse responses after inoculation. And a total of 117,000 cases have been reported, and the rate of reporting stand at about 0.46%. And among these cases, about 95% are common and also mild symptoms, and about 4.9% 6% more severe and severe symptoms and death also. And also we have about 0.6% for Janssen and also a 0.06%. 0.23% for Moderna. And as for these COVID-19 adverse responses, we have been looking at these screenings by our compensation team. We have had about 24 rounds of meetings, and we have looked at about 400 anaphylaxis suspected cases, and we have been looking at these cases, and about 100 of them have been deemed to have correlation with the vaccines. And of the AstraZeneca vaccines, we have 5 cases that have been deemed to have relationship with the vaccine, and 1 also had the blood clots, and also we have seen a total of 5 deaths or severe cases which have been concluded to have the relation with the vaccine, and we had 2 cases of the Pfizer vaccines having relationship with the vaccine, and these include also heart inflammation and so forth. And also during the 24th meeting that was held in late July, we have also been looking at 91 severe cases and death, and also 31 anaphylaxis suspected cases, and we have seen that 12 new anaphylaxis suspected cases have had the correlation with the vaccine. And as for cases that did not have the correlation with the vaccine, we had other causes, including other diseases and also other underlying illnesses, and we also had 1 Guillain-Barré symptoms, and also we have seen that these 4 cases have had inadequate and insufficient amount of material and evidence, and we have classified 14 of these cases to be subject to the compensation. And we are rolling out the COVID-19 vaccines in full-fledged, and we need to also take particular precautions for any severe responses after inoculation. Please note that anaphylaxis suspected cases could occur in all of the vaccine types, so it is best for you to stay about 15 to 30 minutes after inoculation at the vaccination center, and also after returning home, monitor your condition for the next 3 hours. And lately, we have seen Pfizer and Moderna vaccines that have been rolled out lately. And as for these major responses, we have the heart inflammation symptoms. So it is very important that you look at your monitor your conditions for the next 3 days after the inoculation, and also avoid any intensive physical workout and activities during the next 1 week. And if you experience chest pain or difficulties in breathing, or also a racing heart, or if you faint, so if you have these new symptoms, you need to also be suspicious of the heart inflammation, and you need to visit a doctor as soon as possible. And as for the AstraZeneca or Janssen vaccines, you could also be exposed to the risk of blood clots. And also, it is very important that you look at these precautions. And please note that the blood clots may occur during 4 days and 4 weeks after the post-inoculation. So it is very important that you monitor your conditions within this period of time. And if you have blurry eyesight, if you have stomach ache, or also if you have severe symptoms like difficulties in breathing or swelling of the legs and arms, you need to also take particular precautions. And as for the COVID-19 outbreak, for the past week, we had a daily average of 1,506 cases, which is about 2.8% on week increase, and we can see that our spread is continuing. And also the nationwide reproduction rate has slightly decreased to about 1.04. It is still very significant because we are surpassing the threshold of 1. And we have a level 4 distancing measures in the metropolitan area, and we believe that the increase in the metropolitan area is slowing down and is stagnant. And in the non-metropolitan area, we are also seeing a slight increase in the average daily cases, and Busan, Gyeongnam, and Daejeon, we are also seeing continued outbreaks. And I need to make some corrections. In the non-metropolitan area, during the past week, we have had about 541 cases, which is a slight increase from the previous week. And as for imported cases, we had a slight decline to about 63 average daily cases, and we have about 280 cases weekly as for the critically ill patients, and the weekly death toll stands at about 27. And during the past 4 weeks, as for the sources of infection, we have a small cluster infection stemming from families, acquaintances, and also physical gatherings. And also in non-metropolitan area, we are seeing wider cluster infections. And by age group, those between the ages of 20 and 50 account for a majority of the cases. And also in those teens, we have seen an increase for the past 4 straight weeks. And also those aged over the age of 60, we have seen a slight increase as well. And the quarantine authorities would like to note that as for the critical patients and also the fatalities in our May and July, we have looked at the analysis of how effective these vaccines were on these people. And we have looked at some about 34,000 people, and we have looked at their inoculation, and about 96% of them were not inoculated. And also we had only 99 people who have been fully vaccinated out of these people who have contracted the virus. And also about 93% of the fatalities were not vaccinated. And also under the age of 60, a majority of them were not vaccinated, and over the age of 60, about 96% were not inoculated. And so we would like to note that even if you contract the virus, please note that vaccination can help you to reduce the risks of risks of fatality and also severe symptoms. So please participate in the vaccination process. And we are seeing a stagnant increase in the 4th wave thanks to your continued participation. And also we are seeing a continued decline in the rate of cases as for those who have severe symptoms thanks to your participation as well. However, we are seeing a rampant spread of the Delta variant, and in order to contain the spread of such variant, it is very important that we continue to roll out our vaccines and also take stringent quarantine measures and also intensify our antivirus measures. And during the summer vacation season, we ask you to travel in small family groups and also be safe. And you need to wear your masks at all times, and please minimize your contact with other people who are not your immediate family members. And if you have any clinical symptoms of COVID-19, including cold-like symptoms, please get tested as soon as possible. In order to best prevent you from the infection, it is very important that you get yourself vaccinated. And we also have our second dose inoculation for those in the 60s, and also in the month of August. So we ask you to get your second shot if you are eligible. And also as for those over the age of 60, if you have not yet been received your COVID-19 shot, please get your COVID-19 first dose, and please do utilize this COVID-19 vaccination process. And we would like to continue to exert our full efforts that about 70% of the population gets their vaccine doses by September. Thank you very much.
Right, that was Cho Eun-kyung with Monday's afternoon briefing, and I have our Kwon So back here at the desk with the gist of her address. Right, So?
Right, Sunny. Let's begin with the weekly assessment of the COVID-19 situation here in the country. There's been a rise by around 2.8% in cases in the past week, with an average of number of domestic cases in the past week standing at 1,506. There has been a slight decline in the capital region, however, an increase outside the capital region. And also, Tong mentioned that the rising trend is continuing despite some slight improvements, and also that the Delta variant is is spreading at a fast rate. She also mentioned that there's been an age group that has been seeing a rise in cases, which is the younger population, teenagers, and that seems to be because that age group has not been vaccinated yet, of course, with the exception of senior high school students. Meanwhile, on the vaccination completion rate, there's now been almost 87% those aged in their 60s that have been vaccinated, 70% those in their 70s around 89.5%, and 30.5% in their 80s, and those older than that age group around 77% have been vaccinated. So with that, Song stressed again that everyone should cooperate on the vaccination front, and also that people should monitor their situation after getting vaccinated for 3 days.
Right. All right. So thank you very much for that.
My pleasure.
우리 국민들이 많이 거주하고 계시는 동남아 지역의 확산세가 두드러집니다.
해외 입국자 발 감염 확산에 대한 우려가 높아짐에 따라 8월 변이 바이러스 유행국가 총 26개국을 선정하였습니다.
The Delta variant continues to challenge health systems across the globe, and in this session we take a closer look at its repercussions here in Asia. For more, I have Professor Kim Moon-kyu from Yonsei University. Pleasure to have you back, Professor Kim.
Thank you for having me.
And joining the session virtually is Yoichiro Tatewa over in Japan. Welcome back, Yoichiro.
Hi.
And I also have Zen Nguyen over in Vietnam live on the line. Good to see you again, Zen.
Hello.
Right, Professor Kim, we'll start here in the studio then. It's been almost a month since Korea's daily tally has been hovering above 1,000, despite efforts to push that figure down. How do you explain this relentless spread?
Well, at the beginning of this pandemic, I think the virus load to Korea was a little bit light, and we did good management at the time. The first surge in 2020 was in Daegu, and the daily new cases was about 12 per a million population. And the second surge, I would say, it was in August, and it was about 6 cases per million. And November 2020, we had a third surge, and at that time it was about 20 cases per million. After the third surge, the daily new cases dropped down and maintained in about 10 cases per day per million. But now it's about 30 cases per million. So you can understand that it is quite higher than before. I guess until the third surge, I think it was a previous variant. And the fourth surge is caused by the Delta variant. And it might have been worse or even higher mortality if we did not have a vaccination program. And the original COVID-19 virus had a R number, which means a reproduction number, about 2 to 2.5, which means one person can spread to 2 persons. But now we know that the Delta variant has a R number about 5 to 8. And as we know that the R number higher, that means you're more highly infectious. And for example, if we think about chickenpox, it is about 9, and it's almost reaching the number of chickenpox, this Delta variant, I mean. And if you want to deal with chickenpox, we do a different kind of quarantine measures in hospital. So that means we are dealing with a very difficult variant right now. I think there are 2 reasons that we still have a high surge in this fourth surge. One thing, we didn't have enough vaccination at the beginning of this year. And the second reason is that we didn't know well about the Delta variant, and we didn't have proper plan to deal with this Delta variant.
Right, which is much the case elsewhere, of course. Now, moving beyond national borders, in Japan, Yoichiro, how is the public there responding to the expanded state of emergency starting on this Monday amid the record levels of infections there?
Sunny, it's been long since, the government started this state of emergency. So it's sad to say, but the public itself is not taking it seriously. It just, it's another, daily life. And as you can say, the state of emergency in Japan is not like the lockdown policy, happening in Europe. So it's not preventing anything. We can go out, we can go see, the people shopping, and we, as you can, we also have an Olympic game, even though we don't have any audience there, but we still have Olympic Games here. So the impact of the state of emergency, unlike what the government is wanting, is not really efficient. And the people around me, or the journalists around me, we discuss every day, not much impact on Japanese people. So it doesn't make any difference. It's another day is the situation right now in Japan.
I see. Meanwhile, over in Vietnam, then, also on this Monday, authorities are imposing strict curbs on movement in Ho Chi Minh City. Could you tell us a bit more about the containment efforts in Vietnam, then?
Sure. I think it will be instructive for us to look at the current wave Vietnam is fighting if we put it in a context. So the country maintained a hard-to-beat track record for most of the pandemic, thanks to comprehensive testing, tracing, quarantining, and strict border control, and other basic public health protocols such as mask wearing. Right before this fourth wave, so in late April, there were less than 3,000 cases and 35 deaths. And then the Delta variant emerged and changed everything. Today, we are looking at a tally around 54 times that, so over 157,000 cases as of this morning, and more than 1,300 deaths so far. Most of the cases are found in Ho Chi Minh City, and it is the southern economic hub. Because of the sudden vertical surge in cases, the healthcare system is being tested to the limit. Since early last month, Ho Chi Minh City has extended the lockdown 3 times until August 15. Residents are only allowed to leave home for necessities such as food or medical emergencies, or to go to work at businesses that have been granted permission to remain open. A curfew has also been imposed, with people forbidden to leave home between 6 p.m. and 6 a.m. It is not just Ho Chi Minh City, but travel restrictions or social distancing measures have been imposed in 1/3 of 63 localities in Vietnam. Compared with previous outbreaks, residents have also faced unprecedented police checkpoints to set up to curb and monitor movement. Just 2 days ago, the government became more explicit about the lockdown rule and forbade people from leaving their neighborhood to prevent infection spread, any potential risk of infection spread, unless they have the authorities' permission. This happens after thousands of migrant workers left Ho Chi Minh City and other southern localities. They are people who have either lost their job and they are either also afraid of the virus and they wanted to return to their hometown.
Right, of course. Professor Kim, the Delta variant appears to be particularly prevalent here in Asia. What do you believe is behind this reason? Behind this reality, that is?
Asian countries were relatively spared at the beginning of this pandemic, and they might have not think that the need of the vaccine was that serious. Also, there might have been some other financial issues or political issues also. But as we expect from the coronavirus, it mutates, and it will continue to mutate in the future. Now it is a post-vaccine era, so we have a vaccine. So it's not like as 2020. And countries with effective vaccine program have a quite different picture compared to countries who do not have a vaccine program. If we look at some East Asian countries, the average of the new daily cases about 50 cases per 1 million. And one of those worst hit countries are Malaysia, Indonesia, Thailand, and and those are mostly affected by Delta variant. India had a surge in April after some kind of Hindu festival, and it reached the peak at early May, which had about 280 cases per million every day. And it followed by other Asian countries neighboring India, like Nepal, Bangladesh, Cambodia, etc., like that. So I'm sure that I'm not sure that Delta variant is deadly, but if the hospitals are all overwhelmed, I'm sure that people might succumb because of they cannot reach the hospital, they cannot find proper treatment, they cannot have oxygen. So I think all the Asian countries should prepare for extra beds, oxygen, and vaccine supply, and continue quarantine measures all together as mandatory.
Right. Meanwhile, Yoichiro, do health experts in Japan see a link perhaps between Tokyo's hosting of the Olympics and the country's resurgence in COVID-19 cases?
It's a bit of discussions. The Olympic, we have Olympic Games here, and we have been discussing if we should postpone it or not, or we should have an audience. And right now we have an Olympic game, and the result is that growing number of infections. The pandemic is taking place right now. The government stance is that there's no evidence connecting this Olympic game and this pandemic. Of course, there's no evidence because there's no survey. And the question is, are we going to have the survey? And maybe the answer is no. And it seems like a government is trying to pass through the time and so see what will be happening. But experts, prior to this Olympic game, experts, which is very unusual, the experts advising the government independently made a statement saying they're not sure if the Olympic game would affect this pandemic, but they are sure that this Olympic game will give the public the wrong statement that we are about to be the time to be careful about the virus. But since we have the Olympic game, so that would give the wrong message to the public. So I can say, the one thing is that we don't have any clear evidence that the Olympic game and this pandemic has a connection, but we surely easily assume that having this Olympic game would give us the wrong message. So as we said earlier, Japanese public is not taking this the state of emergency seriously, because if we can go out and we can have a shopping, we can go see we don't have time to go see the Olympic game itself, but we are enjoying the Olympic game. So this atmosphere right now in Japan is not really sufficient to be careful about the virus.
I see. Meanwhile, Sen, the latest outbreak in Vietnam appears to have severely, that is, disrupted its manufacturing industry. What more can you tell us?
Yes, Sunny, the government has allowed factories in industrial zones to continue operating if they can provide on-site accommodation or transport to make sure that workers go home, will go straight home after work. It is not as a stay-at-work model here. Those that cannot fulfill these conditions have to temporarily close. Many enterprises reportedly do not dare to apply the stay-at-home work model now because of the big risk and responsibilities. And those that have already done so plan to reduce the number of workers or even suspend production. In the second quarter of this year, which was also around the same period that the fourth wave hit Vietnam, export turnovers rose 33.5% compared to the same period last year, and it was estimated at around $79 billion. The The main export items were electronics, phones, computers, and textile. Vietnam is an increasingly important country in the global supply chain. The government is trying really hard to keep the economy running while making efforts to suppress the coronavirus curve. But the situation is grim for many people. Almost 1.2 million people lost their job in the second quarter. And those between the age of 15 and 24 comprise 1/3 of this group. So this can potentially affect their long-term employment prospects. The impact of the birth rate is going to be even more devastating for the most vulnerable members of our society, like those who cannot work from home, like you and me, like delivery workers, informal workers, and labor migrants.
I see. Meanwhile, back here in the nation, Professor Kim, as it was mentioned in today's afternoon briefing, that is Monday's afternoon briefing by Jong Kyung, we have on average about 63 imported cases of COVID-19. What are your thoughts on efforts by authorities here to control the influx of imported cases?
We're doing well right now, I think. And since May, Korean government started to allow quarantine exemptions for the countries with a good vaccine program. But in August, there are 26 countries which were excluded from quarantine exemptions, and most of them are countries prevalent with Beta variant, Gamma variant, and Delta variants. Most of them are from Asian countries, some African countries, and South America countries. And if somebody comes in, we have a PCR test on arrival, and they put person from those 26 countries, they put in an isolated facility and for 7 days, and they do another PCR test. If all is negative, you can move to another place for self quarantine measures. I think this will work out for a while. Because Delta variant has a similar incubation period and everything. But as I told you, coronavirus is going to mutate, and I hope that Delta variant will be the end of this pandemic. But we already know that we have Lambda and etc. So as we were not prepared so well for this Delta outbreak in this year, I think that we should be vigilant as far as we can and monitor everything. The next variant might have a different kind of characteristics, and the gateway is the airports, and that's the first place that we should start surveying.
Yoichiro, I hear authorities in Japan have also recorded breakthrough infections. What has been shared thus far about these cases?
As Professor Kim said, the virus itself is mutating, and right now, so Delta variant, and it's all over Japan right now. And then one of the things the government probably made a mistake is that they think the vaccination is the only way to stop this pandemic. But because they think that, they're overstated about this, the merit of the vaccination. So there's the sad misunderstanding among the public. They say this vaccination could prevent infection itself, but it doesn't prevent infection. It does prevent outbreak or the severe illness of this symptom, but it doesn't prevent any infection. So the virus could move around. So the vaccination can stop this, the seriousness of this, the virus, the COVID-19, but it doesn't stop it. So we should have this the better understanding. But I'm not an expert. I'm just a journalist. But I look at this document, and some of the mainstream media can also are misunderstanding that even the vaccination cannot prevent the infection. It doesn't prevent infection, but it does prevent the seriousness of this illness. So so we should be very careful about the stating the merit and also the truth. So transparency is very important. And right now, the Japanese government is not handling well about the dealing with this true information. That's very sad, but they have to change it.
Right, and staying with vaccines, very quickly speaking, Zen, how is Vietnam proceeding with its vaccination drive?
Yes, Sunny, since the end of February, Vietnam has received over 14.8 million doses from overseas manufacturers, some of which I believe is also from SK Bioscience in South Korea. Of these, Vietnam has administered less than half, according to data from the Health Ministry. Because of the current outbreak and the short supply of AstraZeneca, which Vietnam is heavily reliant on, there's been rapid development in vaccine policies. Within a short span of time, the government approved a bunch of foreign vaccines for emergency uses. This includes Sputnik V, Pfizer, Moderna, Sinopharm, and Johnson & Johnson. The government has been trying to get vaccine from both the international COVAX facility and commercial contracts. Vietnam entered the global vaccine market quite late. And because of its reliance on AstraZeneca, its vaccination rates unfortunately trail behind most of its Southeast Asian peers. Today, less than 1% of the population is fully vaccinated. In comparison, the same figure in Cambodia is 28%, and in Thailand is 5.2%, I believe.
Hopefully the inoculation will pick up pace in Vietnam then. All right, Zen, thank you very much for your thoughts. Yoichiro, thank you for being with us today. And Professor Kim here in the studio, thank you for your insights.
Thank you.
Thank you, Sandy.
Right, authorities here are looking into the possibility of tougher prevention measures should the daily tally remain above 1,000 throughout this week. So do stay safe. See you on Tuesday.